Remove the muscles. Hi, today we are going to talk about the oral cavity. It's also known as the mouth, part of the alimentary canal. It has three major functions: digestion, communication, and breathing. The oral cavity spans between the oral fissure. It is open between the two lips anteriorly and the oropharyngeal isthmus posteriorly. Division of the oral cavity: it has two parts: vestibule, which also called labial cavity, and oral cavity proper or buccal cavity. Start by vestibular cavity, situated anteriorly between the lips and cheek externally, and teeth and gum internally, horseshoe shape. This is space called vestibular cavity. This is the lips and cheek. This is the teeth and gum. The content of this cavity is the open of the parotid gland duct, opposite the upper second molar teeth. Remove the muscles. This is the parotid duct, and this is second upper molar teeth. Then move to the oral cavity proper. Lies posterior to the vestibule. It is bounded by roof formed by soft and hard palate, floor formed by the tongue, mucosa folding to the tongue, sublingual and submandibular gland, genohyoid muscle, and myelohyoid muscle. Posterior boundary is the oropharyngeal isthmus. Anterior and lateral boundary, teeth and gum. Content of the oral cavity proper. The tongue, muscular organ, has two parts: fixed part called the root here, and free part here, which is called the apex of the tongue. Has two surfaces: dorsum and inferior surface. The dorsal surface divided by sulcus here called sulcus terminalis into anterior 2/3 and posterior 1/3. In the anterior 2/3 there is sulcus here called median lingual sulcus. In the anterior 2/3 of tongue there is collection of the taste spot which is called papillae. Here, anterior to the terminal sulcus called vellae papillae. In the apex, fungiform papillae. In the body of the tongue, filiform papillae. In the dorsum of the tongue, there is a lingual tonsil. This is a microscopic view for the papillae. This is a vellae papillae, and this is a fungiform papillae, and this filiform papillae. This is lingual tonsil. Then move to the inferior surface of the tongue. In the middle here, called frenulum. Lateral to it, there is deep vein, which is called deep lingual vein. Here, it is the open of submandibular gland. Between 20 to 20 small opening called sublingual gland duct open. Then move to the muscle of the tongue, divided into extrinsic muscle of the tongue and intrinsic muscle of the tongue. The extrinsic muscle of tongue moves the whole part of the tongue, and the intrinsic muscle of tongue folding the tongue. According to their name, the action. First, they start with the intrinsic muscle of the tongue. There is a fourth muscle. There is superior longitudinal and inferior longitudinal muscle. The third muscle is horizontal muscle of the tongue. The last group is vertical muscle of the tongue. Four muscles: superior longitudinal, inferior longitudinal, horizontal, and vertical. The superior longitudinal, when contract, folding the tongue upward, and the inferior longitudinal, when contract, folding the tongue downward. Then the horizontal group, when contract, folding the tongue inner wall. Then the extrinsic muscle is the foremuscle muscle. From the styloid process to the tongue, called styloglossus muscle. From the gene of the mandible to the tongue, called genioglossus muscle. From the hyoid bone to the posterior half of the tongue, called hyoglossus muscle. From the soft palate to the posterior one-third of the tongue, called platoglossus muscle. Four muscle: styloglossus, genioglossus, hyoglossus, and platoglossus muscle. All this muscle innervated by hypoglossal nerve. It is the 12th cranial nerve, except one muscle, which is called platoglossus, which innervated by pharyngeal plexus. Common MCQs question in the exam. All muscle of the tongue, intrinsic and extrinsic muscle, innervated by hypoglossal nerve, except the platoglossus, which innervated by the pharyngeal plexus. Sensation of the tongue. It is different from the anterior two-thirds to the posterior one-third. Overall sensation in the tongue divided into the general sense and specific sense. The general sense, which is the sensation of pain, pressure, temperature, and touch. When the specific sense, it is a taste sensation. The anterior two-thirds of the tongue send this sensation to the brain via the fifth cranial nerves. When the posterior one-third of the tongue send the same sense to the brain via the glossopharyngeal nerve, which is the ninth cranial nerve. But the specific sense, taste sensation, from the anterior two-thirds of the tongue enter to the brain via the facial nerve, the seventh cranial nerve, and the posterior one-third of the tongue through the glossopharyngeal nerve. Blood supply of the tongue by the lingual artery, the branch of the external carotid artery.